is Jack Shun. This is my Instructor 1 presentation on bleeding, wounds, and shock. So this is going to instruct students on how to deal with a patient with a bleeding wound and then subsequently going into shock. So our objectives for the day, the students will be able to differentiate the 3 types of bleeding, define shock, list the common signs of shock, and then list the steps to control your bleeding. Learning standards, students will be able to effectively treat bleeding wounds and shock, and students will be able to identify a patient in shock. So we have 3 types of bleeding. What are they and how do they present? So arterial bleeds are the most serious type. They're going to be bright red and usually spurting out because it's on an artery, so that's where the most pressure is. Venous bleeding is oozing and dark red. It's easier to control, but it can lead to shock as well, so it could be just as dangerous. And then capillary bleeding, which is your less serious one. It's slow ooze, and it can also clot by itself within a few minutes by just holding direct pressure on it. So here's some illustrations. You have arterial bleeds. So this would be your radial pulse because it's on your wrist. You can see it spurting out and it's bright red. Vein bleeding, it's a little less spurty. It's still coming out a decent amount. And then just your capillary small bleeds like this. So shock. What is shock and what does it do to our bodies? Shock or hypoperfusion, that's a lack of perfusion in the body. This means that there's not enough oxygen being delivered to your tissues via the bloodstream. If this is not treated, your organs and different tissues in your body will die within minutes. So we have 4 major types of shock. You have hypovolemic, which means the volume of blood is too low that your body can't sustain it. Cardiogenic, this is an issue with your heart, so it's not pumping correctly, and then that also leads to lack of circulation. Obstructive shock, your vessels are blocking something, so your heart may be working fine, but your vessels are what's blocking circulation coming through. So something that would be cardiac tamponade, which is blood filling up into your myocardium, which is around your heart. And distributive, which is kind of a catch-all. You have septic shock, neurogenic shock, and anaphylactic shock. And those all interfere with your blood flow differently. So how to control your bleeding? You're going to need a few different pieces of your PPE and equipment. So PPE, most important thing you're going to want is gloves and eye protection, because if it's spurting, you don't want to get in your eyes, and you also don't want to be touching patient, giving them an infection. Also, you're potentially infecting yourself. So gloves, eyes protection, your N95 mask, which is important today because we live in a COVID world, and then possibly an EMS gown to help prevent blood getting from your clothes and making them a biohazard. And then this is our actual EMS supplies that we're going to have to use. So here we have our rolled gauze, an abdomen pad, which could be good for absorbing. Use that as a dressing. We have non-sterile gauze. You can just use those. Also help clot. A cat tourniquet and trauma shears. And also, I didn't have it on here, but we're going to need a marker so you can write your time on your tourniquet. So steps to controlling your bleed. The first thing that you're going to want to do is probably the most important, is applying direct pressure with either your gloved hand or some sort of dressing. That could be the abdomen pad or just loose pieces of gauze. So you hold direct pressure, keep holding, and then let off a little bit, just see if it stops. And if it doesn't, apply more dressings to your wound if you already had some. If your bleeding does not stop, keep adding dressings. You could try that. And just a little note, if you keep adding dressings, make sure you add new ones on top. Don't move the old ones, because those old soaked gauze are going to be helping form your clot. That's going to stop the bleed, potentially. If the bleeding continues, you could try wrapping your gauze with some sort of wrap or co-band, something like that. If your bleeding is still uncontrolled, you can apply a tourniquet, and we'll go over how to do the tourniquet later. And to ensure, and then you want to mark when your tourniquet was applied, the time. That's important for the emergency room to know. And to ensure your tourniquet is working, you're going to keep applying pressure, so keep pulling, and then you should only have 1 or 2 twists on your windlass cord. But you're going to know it's working when your distal pulse, so usually it's going to be your radial pulse or your pulse on your foot. Those are going to be gone and your bleeding will stop. So tourniquet placement and application. So a tourniquet can either be slid on the arm, kind of like a big ring, or it could be looped through, like a cuff, I guess would be a better way to say it. So your tourniquet should be placed 2 to 3 inches above where your bleed is. That's if your joint is not in the way. So if you had a cut right here, right below your elbow, you want to go right above your elbow. Tighten the strap as tight as possible, so keep pulling. It's going to hurt the patient, but that's what's going to help stop the bleed. So get it as tight as possible, and if you pull it correctly, you're only going to need to turn it 1 or 2 times. Once you have seen that the tourniquet is working, you're going to want to check for distal pulses. So again, either your radial pulse or the one in the top of your foot. So feel for those. Those should be absent, or your bleeding is stopped. And then when you're done with that, wrap the excess strap around, and then again, write your time on the tourniquet. So this would be a little Q&A kind of thing. I have a tourniquet, mostly correct tourniquet application here, and how the students ask or go over what was wrong, which would be you haven't wrapped around your excess strap and you didn't mark your time, which it's a photo, but it wasn't a life or death situation. And then, so now we're going into stages and signs of shock. So again, hypoperfusion, you're not getting enough oxygen to your organs and your tissues. So signs, patient is in the compensated stage of shock, which is the first stage. Restlessness or anxiety, they're going to be moving a lot, they're nervous, which makes a lot of sense. Clammy skin, can start perfusing, vomiting, nausea, thirst, and delayed capillary refill on your nail beds or your skin. Signs, patient is in the decompensated stage of shock, is tachycardia, tachypnea, labored breathing, cyanosis, and a lower body temperature. So the final stage of shock is the irreversible stage of shock. So this is the stage, once the patient gets here, they're most likely going to die, and if they don't, they're going to be severely handicapped mentally. Organs and other vital bodily functions are going to be damaged beyond repair to where they can't be fixed, and these patients will present with decreased cardiac output and a low blood pressure. So once they get here, death is imminent. So as a BLS emergency care provider, there are 4 things we need to do when we are going to be treating shock, which is administering oxygen via non-rebreather, 15 liters per minute, so give them as much as you can. Elevate your feet, that'll help move the less important blood from your feet, move down into your chest and your brain. Cover your patient with blankets to keep the body temperature warm. A lot of heat's going to be releasing if they're bleeding. And immediate transport. That is one thing that a lot of people will miss on their national psychomotor exam, is forgetting to say immediate transport, but it is also very important to mention and also do. My reference is a Limmer chapter 25 lecture, and then any questions I would have, and at this point I would hand out